She's been a celebrity OB-GYN for over 20 years. Stars in Bravo's hit series Married to Medicine. And her clientele includes stars like Toni Braxton and the families of T.I. and Usher. She recently released the book, The Queen V. Everything you need to know about sex, intimacy, and down there healthcare. Please welcome Dr. Jackie Walters. Thanks for being here.
Thank you for having me.
So can I just ask, before we get into the Queen V insights, T.I.'s took his daughter, accompanied his daughter for virginity testing. You have a good relationship with T.I., so I don't want to put you in an awkward spot, but what do you feel about accompanying your child for virginity testing?
Let's clarify. I don't think he meant that in a serious way. I think he started out joking, and of course it blossomed into something else, but I don't think we should be doing that. You know, I don't think I want my dad to go with me to the doctor to see if I'm a virgin, especially if I'm not.
Especially if you're not. Is there really such a thing as virginity testing?
It isn't. There's no test, because some women aren't even born with a hymen. You can destroy the hymen in sports.
Sure.
Yeah, and then surgeries. Of course, you know, we could disrupt the hymen there, so no.
Okay, just got past that.
No.
Now, one of the reasons you wrote the book was because you feel so passionately about the need for us to understand our own bodies.
Absolutely, absolutely. I think we're in an era where women are disempowered. And I wrote the book because I want to empower women to, one, speak up about feminine health, and two, to protect that vital part of their body and treat it like royalty.
It is royalty.
It is.
And we're ashamed about it. We hear about it from our mom at age 5, and maybe she had it wrong, maybe we don't remember it right, or maybe the science changes. But here you are all these years later believing oftentimes myths, well-intentioned as they may be, that can take you in the exact wrong direction.
We can't even say the word when we're born. You know, in some shows you can't even say the word. And so kids are raised not saying the real word. We give it names.
Oprah told me, when I was doing the Oprah show years ago, she would say, call it vajayjay.
Vajayjay.
The JJ.
Yes.
I got it wrong still.
Vajayjay.
One thing you comment on that I adored, because it's so true, is this concept of a doorknob question.
Yes.
So doctors know this, but most of you don't. Please explain this.
So most of the time for women, and I see all women, they come in the room and they'll talk around the real situation. And a lot of times with physicians, we have only a limited amount of time. When you stand up and your hand hits the door knob, it's like, okay, I need to say this.
One last thing. Just one last thing.
One last thing,
yeah. I walk out.
And that's what they really want to talk about. And women are embarrassed to talk about it, and they may want to tell you something they did or somebody. And, and so that doorknob question comes out, and they really talk about what they want to tell you.
And one of the biggest doorknob questions has to do with infertility.
Absolutely.
You have been very open, which I applaud you for, about your own struggles with infertility.
Yes.
Why is that why is it so difficult to talk about?
Women somehow take on ownership for infertility. And I'm not sure why we do that, but there's a stigma around infertility as if it's the woman's fault. And we don't like to talk about it because we feel like either we did something wrong or we didn't do something right. And I want to dispel that myth that infertility is a woman's fault, and it's not.
So, to speak honestly, you got to get comfortable being uncomfortable. You're a big proponent of that.
Yes. Yes, I mean, go back to infertility. I'm okay sharing my story that makes a lot of people uncomfortable saying I'm infertile as an OB-GYN and I never had a baby, and I'm comfortable with it.
It's hard to get around that, though.
Oh, it takes work. It takes work, but you can get around it. Just start doing it. A journey of a million miles starts with one step. Just start doing it.
All right. So are you okay with answering some uncomfortable questions from around the country?
Let's do it.
All right. These were viewers who were so embarrassed they didn't want to put their names on the questions. We're going to protect them, but these are common questions. I know many of you have. We're going to start with your hometown of Atlanta.
All right, Atlanta.
Where Share Care is based.
Yes.
All right. So I've douched for many years, but recently a friend told me I should stop. Is there anything wrong with douching?
Listen to your friend on this, and there's a lot wrong with douching. There's a bacteria that should be in the vagina, lactobacillus, and douching washes away that lactobacillus, changes the pH of the vagina, and sets you up for a ton of infections, bacterial vaginosis and yeast, so no douching.
So down there is really a self-cleaning oven?
It's a self-clean, that's exactly what I said in the book. It's a self-cleaning oven.
Making sure you got it in
Yes.
there. Up next, even more of what you wanted to know, but were too afraid to ask of your GYN. We're going to take all your awkward questions. Stick around. We're back with celebrity OB-GYN Dr. Jackie Walters, who's here with everything you need to know about down there, but you're too afraid to ask. So we reached out to our Dr. Oz viewers across the country and asked them to send us the questions they've been too embarrassed and afraid to ask their own OB-GYN. Next question is from Dallas. Here's a question. I have bad reactions to taking the pill. My doctor suggests trying the ring for birth control. I'm nervous about the procedure. How does the ring work?
So the ring is really a birth control pill in a plastic form.
I brought you a little demo. You
Okay,
like demos?
yeah, let's do it. Let's do it. So of course, this...
Just orient everybody here.
All right. Of course, I know everybody in the room knows what this is, right?
But this is for the men.
Okay, for the man. All right, so this is the female body in a sense: vagina, cervix, uterus, bladder, rectum. And so the ring works with medicine embedded, estrogen, progesterone, just like in a birth control pill. It's embedded in this plastic.
And once it's down around the cervix, it secretes its hormones like that.
Absolutely. The body absorbs that just like it would if you were taking a pill.
And it secretes it for 3 weeks, and then the 4th week, it comes out.
Right, exactly. You take it out, and then that's the week you would probably have a period.
Okay.
Okay? And so the ring is inserted by almost like you could do a tampon. Put your foot up if you're comfortable doing that
I've
way.
never personally done this. But
Never?
No.
Okay. All right.
I'm trusting
As a doctor, you've seen it.
I've seen it.
Right, and so the ring is compressed, slid into the vagina, and there's no absolute place to put it in the vagina as long as it's in there. And it typically kind of fits here in the back of the vagina. It doesn't slide out like this in most cases. But it's there. It's kind of...
Well, I mean, can I ask a guy question here?
Please.
I mean, doesn't it get in the way?
No, not at all.
I mean, it looks like it would get in the way. I'm just looking.
No, it becomes very, it becomes very soft and gelatinous. Most men, not all, but most men won't even know it's there.
All right.
And so it just kind of says right there, and the body, like you showed, it keeps you from getting pregnant.
And in the 4th week, you just lick it.
You kind of take your finger, slide it right out.
I'm impressed.
Yes.
Do OB-GYNs use that? Is it popular?
Oh, yes. Oh, yes. I mean, think about it. You don't have to think about it for 3 weeks. It's there. You're not having to remember to take a pill.
I love this segment. This is
Yes,
fantastic. I never knew about these things.
There you go.
I got all kinds of advice I can give on this now. All right,
Yeah.
final question is from Philly. It's my hometown, by the way.
All
Here it
right.
is. If someone is tested positive for HPV, can it be transmitted orally via saliva, or sharing utensils, or kissing a child? What do you think?
So HPV, human papillomavirus, we do believe, and the answer really is maybe, but we think it is definitely transmitted orally, but not from a utensil or kissing your child on the forehead. It has to be typically real oral. So the answer is yes to the oral, but no to utensils and your child.
God bless you for being here with us
Thank
and
you.
sharing the wisdom you've got. For everything you want to know about sex, intimacy, and down there health, you can check out Dr. Jackie Walters' new book, The Queen V. Now, this audience is really curious about this topic.
Yes.
Do you think we have a couple copies for them?
Oh, certainly. Let's do it.
All right, you're all going home with a copy. Everyone in the studio audience. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.